You're watching Joy News today. Now, away from that one Ghana cedis bail imposition, patients seeking medical care are facing significant challenges as the government's deployment of police officers to protect nurses and midwives who have chosen to defy the union's strike has created a chaotic situation in healthcare facilities. The Ghana Registered Nurses and Midwives Association had withdrawn outpatient and emergency services due to the government's failure to implement agreed-upon conditions of service with police presence. Some nurses and midwives have opted to continue working, but the situation remains tense. Patients are caught in the middle, struggling to access essential healthcare service. The union initiated the industrial action due to the government's failure to implement agreed-upon conditions of services, citing repeated delays and inactions. Now, let's engage my colleague Clinton in Kumasi to bring us an update on what's happening in Kumasi. Clinton, what's happening in Kumasi with the healthcare providers?
Currently in Kumasi, the places I've been to, Komfanoche and the Pampaso Children's Hospital, patients are being turned away. And specifically at Pampaso Children's Hospital, as a children's hospital, postnatal and antenatal care has been halted or withdrawn. And I saw a patient who went into consulting room and came back without getting any care, and she had to, with all sadness, had to get back. Now, what they make of this situation is that their situations could worsen because they don't know how bad that their situation can get if they do not receive the necessary care at the hospital. But the leadership that we have also spoken to are very resolute on the directive that has come, that until they hear any favorable resolution or any favorable information from government, they are going to stick on to the strike.
Well, Clinton, in Kumasi, do we have some healthcare providers, especially nurses and midwives, who, despite the strike action, are still providing services? And do you see any security personnel as well around?
Not at all. It seems they are in full force of the directive, and you could feel the effect so much because some patients were here as early as 5 a.m., but they had to get back because they were turned away. So the effect of the strike action is really in full force.
Right. Thank you so much, Clinton. Now, away from Kumasi, back in Accra, Collins Frimpong is also bringing us a report in Accra here. Collins, what's the update from you as well?
Different from what is happening in Kumasi. Currently, if you go to the Kolebu Teaching Hospital, the situation is quite difficult for patients. And we've been to several outpatient departments, including the AFT and the Pedic Central Maternity and Medical Hospital. These areas, the visited areas this morning. All the see is that have the form. And inside the wall,
Collins, to hear you, can you just kindly reposition yourself, Collins?
Can you hear me?
Now it's better. You were saying from Kolebu Teaching Hospital.
Right. So I am saying that at Kolebu Teaching Hospital, the situation is quite difficult for patients. We've been to about 5 people at the teaching hospital, including the patient department, including the outpatient. We've been to the central and the maternity, as well as the medical, is seeing that before. And inside the impact it is difficult for nurses to patients. And also
again, let's try again. Repositioning and see if I can hear you.
Can you hear me?
It's only when you say, can you hear me? But let's try again.
Right. So all that I'm saying is that at the Kolebu Teaching Hospital, the impact is being seen. And we've been to different OPD departments at the Kolebu Teaching Hospital, including the central, maternity, and the surgical OPD. And we've seen that services have come to a complete halt in these OPDs. And in some areas, nurses were seen engaging in personal conversations while patients were struggling for assistance.
Well, did you at least see some nurses? I mean, I see that you say services have come to a complete halt, but there's not a single nurse working at all, defying the directive from their mother body?
No. With the OPDs that we went through, there is no nurse, no single nurse that we saw working. As a matter of fact, around the ward, you can't see anybody there. But when you get closer to some of the wards inside, you could see that some of the nurses are inside. I entered one of the wards where I saw about 5 nurses inside there, and all that they was that they are not going to engage the nurses. And as a matter of fact, they have already informed the patients who are stranded that they are not going to attend to them. So they should find a different facility to attend.
Okay. Collins, thank you. Collins Frimpong bringing us a report from the Kolebu Teaching Hospital on the update on the strike action. We'll be following the strike action and as well be updating you. But away